Charlotte French from ISVPS. There you go, Charlotte.
Thanks, everyone. Good afternoon. My name's Charlotte French, and I'm here from the International School of Veterinary Postgraduate Studies, really to contribute to the discussion which we've been discussing already today, a lot about innovating global veterinary postgraduate assessment. So just a little bit about us. Who are we? So ISVPS are an awarding body. We're a global awarding body delivering accredited postgraduate qualifications for veterinary professionals. And we work very closely with Harper Adams University. And I'd like to thank the QA team at Harper Adams, in particular Dr. Stephen Bohr, who assisted with this particular project that I'm going to be talking about today. We offer several different qualifications, and one of these is the ISVPS General Practitioner Certificate Award. And in fact, the particular assessment that I'm going to be talking about today leads to this, or is part of the assessment diet for the GP Cert. So what I'm sharing today is really just a brief snapshot of how we have worked to develop and refine one of our assessments. But my aim is to open a wider discussion about what effective assessment should look like at veterinary postgraduate level, and how we can achieve this delicate balance needed to ensure genuine assessment utility. And as we all know, the utility of assessment, any assessment, depends on a lot of different factors, and getting them all right is very difficult. So we've got reliability and validity, obviously absolutely key. Educational impact, so potentially the effect that the assessment will have on student behaviour. Acceptability, really important that the assessments are acceptable to obviously the candidates, the examiners, the awarding bodies, any stakeholder who might have a stake in that assessment. And feasibility, so cost obviously has to be a factor considered, and obviously the more expensive the assessment is to run, potentially the less feasible it is and the less useful it is. So it's really sort of how do we balance all of these factors in order to get a genuinely useful assessment at the end of the day. So I'm just going to, as I say, talk briefly about how we sort of refined one of our assessments, and the assessment that I'm talking about is known as the case-based scenario or CBS examination. So as I've already sort of suggested, this is an exam which is part of a wider assessment diet leading to the GP Cert Awards. It is an online secure exam and remotely proctored, and it is a valid assessment reflecting real-life general practice cases. So I'm actually going to be focusing on delivery of this assessment in the UK, where it is delivered and obviously taken in English. As I say, it reflects real-life case management in practice. And historically, this exam was based on one case and composed of entirely UK QAA Level 7 essay-style examiner-marked questions. So all of the questions were essay style, so the candidates had a text box to type their answer into, and then obviously the questions were marked by examiners to a rubric, to a standardized mark sheet. So if we felt this was a valid assessment, which we did, why would we want to change it? Well, the rationale for change really came from candidate feedback. So after all our assessments, we provide a feedback survey for candidates to complete, and obviously we also receive feedback from our examiners. And over about sort of 12 months, the feedback that we were getting from, in particular, candidates in the UK for whom English is a second language, was that this fully written text box essay-style question exam was less acceptable to them. Obviously, if you like, the reasoning behind this assessment is not to assess ability in the English language. It's about assessing how a case is managed in practice. We also did have some feedback from candidates with specific learning differences. This was fairly minor, but we did have feedback from some candidates, dyslexic candidates, saying that, again, they felt that this format of fully text box essay-style questions was less acceptable to them. Now, the other drivers were that we had actually recently invested in a new exam delivery platform, and this allowed auto-marked questions other than traditional MCQ exams. And we felt that these would add, these would be valuable in terms of reaching that level 7 requirement with Bloom's taxonomy, obviously those higher level assessment requirements such as synthesis, analysis, evaluation. And also we wanted to scale this exam. So currently it's an exam which is mostly sat within the UK and delivered in the UK, but we actually deliver globally in 9 languages. And we need, obviously we're looking to roll this exam out because we think it is a useful exam, so we need efficient, scalable processes. So the aim basically was to develop and pilot a new CBS examination format that would increase acceptability to UK candidates and examiners, streamline processes, particularly with respect to examiner marking, but obviously we were aiming to maintain assessment validity, reliability, and educational impact. So again, it was sort of how do we balance this equation but make this exam much more acceptable to our candidates. So working with our partners at Harper Adams University, we developed a new format for this exam. And we actually developed the exam we run assessments in lots of different disciplines, but this particular assessment we developed in endoscopy and endosurgery. And rather than having just one case, so historically this exam was based on one case, all text box answers. We moved to 2 clinical cases. And I think this resonates with the professor's lecture yesterday in terms of more than one, more than once. So we've moved from the 1 case to the 2 cases. So that enables us to assess a broader range of ILOs, but also obviously gives candidates the opportunity to show management of 2 clinical cases rather than 1. And we still wanted to keep some of those examiner marked level 7 essay style questions within the exam. So we moderated, or rather changed things so that 60% of the marks still come from the essay style marked questions, but 40% from the computer marked level 7 questions. And those questions are MCQs, but also extended matching, hotspot, select from a list. Carefully crafted level 7 questions. And rather than just obviously introducing this, we thought it would be a good idea to pilot it with some candidates to really see what they thought about it and to provide some qualitative feedback. So we actually piloted this new format of exam with 15 vets. 5 of them had sat the CBS exam before in endoscopy and endosurgery, so they had the old style exam to compare with the new one. 6 had sat a CBS in a different discipline, but again they had the comparison of the 2 formats. And 4 had never seen a CBS before. 2 candidates had English as a second language. We would have liked a larger population of vets to pilot this, but busy vets in practice. We were very grateful to the 15 that engaged. And what we discovered was that the new style of exam was acceptable to all candidates. And of those who had sat an old style CBS, the majority definitely preferred it. In fact, only 1 candidate said they preferred the essay style questions because they felt that it was a little bit more challenging for them. And 100% stated that it was a good mix of computer-marked and examiner-marked questions. So in conclusion, we felt that we had increased the acceptability of the format of the exam. We obviously have increased efficiency. We've reduced examiner marking time. This could potentially lead to reduced costs in the long run, but we are going to have to be keeping, obviously as we do, we keep a very close watch. We feel this is a very valid and reliable assessment, but we will be keeping a very close watch on that as we go forwards. We have actually implemented this new CBS format this year in some disciplines, and the initial feedback from candidates and examiners has been extremely positive from the post-exam feedback surveys. We're still working on the data for the results, but as I say, early signs, we're very confident in this assessment. So we feel this is aligned with our goals of delivering rigorous, valid and feasible assessments globally. So I'd just be interested to ask how others balance that utility equation. We've got, obviously there's always work to do. And as we've talked about over the last couple of days, there will be ongoing challenges in assessment amid rapid developments with AI technology. Thank you very much.
Thanks very much, Charlotte. And I think that's the key question. How do we balance that? Maybe that's something that we can continue this conversation in future events as well. Are there any questions for Charlotte? No?
That's a relief.
I think you've laid down the gauntlet there, Charlotte. Thank you ever so much.
Thank you.